Hello friends, I hope you all will be fine and doing good. Today we are going to discuss about anxiety and types of anxiety. If you want to know about anxiety, symptoms of anxiety, causes of anxiety, I have already made video about anxiety, symptoms of anxiety and causes of anxiety. You can watch that video. The link is in the description. Okay. In this chapter, you will learn that what kind of anxiety you have. The first point, the first type is generalized anxiety disorder, which is also called GAD. You may have seen most people feel anxious and worried from time to time, especially when faced with stressful situations like taking an exam, speaking in public, playing competitive sport, or going for a job interview. This sort of anxiety can make you feel alert and focused, helping you get things done faster or perform at your best. People with GAD, means generalized anxiety disorder, however, feel anxious and worried most of the time, not just in specific stressful situations, and these worries are intense, persistent, and interfere with their normal lives. Their worries relate to several aspects of everyday life, including work, health, family, financial issues, rather than just one issue. Even minor things such as household chores or being late for an appointment can become the focus of anxiety, leading to uncontrollable worries and a feeling that something terrible will happen. If we talk about what are the signs and symptoms of GAD, generalized anxiety disorder, you may have GAD if the specific signs and symptoms are present for 6 months or more, and one and on more days than not. These include physical symptoms as well. Excessive worrying to the point that everyday activities like working, studying, or socializing become difficult. People with GAD may have related disorders, most commonly depression, social phobia, means characterized by avoidance of social situations or the anxiety conditions. They may also misuse alcohol or drugs and may experience a range of physical health problems such as headaches or bowel complaints. What are the causes of GAD? The first one, biological factors. Some changes in brain functioning have been associated with GAD. Family history. The third one, stressful life events. And the second one is what is social phobia. Social phobia. It's perfectly normal to feel nervous in social situations where we might come under the attention of others, whether they are strangers or people. We know attending a formal function, giving a speech at a wedding, doing a presentation to work, colleagues are likely to cause nervousness and anxiety, both in the lead up and during the event. However, for people with social phobia, sometimes known as social anxiety disorder, means social phobia is also known as social anxiety disorder. Performing in front of others and social situations can lead to intense anxiety. They may fear being judged, criticized, laughed at, or humiliated in front of others, even in the most ordinary everyday situations. For example, the prospect of eating in front of others at a restaurant can be detaining for some people with social phobia. Social phobia occur in the lead up to or during in performance situations such as having to give a speech or being watched while doing something at work. Situations involving social interactions such as having a meal with friends or making small talk. Social phobia can also be specific, where people fear a specific situation or a few situations related to a specific fear, such as being assertive at work or with their friends. If we talk about the causes and signs of social phobia, common symptoms of social anxiety include physical symptoms and psychological symptoms. The physical symptoms that can be particularly distressing for people with social phobia include excessive perspiration, trembling, blushing, or stammering when trying to speak, nausea, or diarrhea. And if we talk about the causes of social phobia, the first cause comes, that is temperament. Temperament means like adolescents who are shy or socially inhibited are particularly at risk. In children, clingy behavior, shyness, crying easily, and excessive timidity may indicate temperaments that could possibly put them at risk of developing social phobia. The second point is family history. The third is learned behavior environment. Some people with social phobia attribute the development of the condition to being poorly treated, publicly embarrassed or humiliated. Example, being bullied at school. And the third point, what is specific phobias? Concern or fear about certain situations, activities, animals, or objects is not uncommon. Many people feel anxious when faced with a snake or spider, heights, or traveling by plane. Fear is a rational response to situations that can be pose a threat to our safety. However, some people react to objects, activities, or situations the phobia stimulus by imagining or irrationally exaggerating the danger. Their feelings of panic, fear, or terror are completely out of proportion to the actual threat. Sometimes the mere thought of the public stimulus or the sights of it on TV is enough to cause a reaction. These types of excessive reactions may indicate of a specific phobia. People with specific phobias are often well aware that their fears are exaggerated or irrational, but feel that their anxious reaction is automatic or uncontrollable. Specific phobias are often associated with panic attacks during which the person experiences overwhelming physical sensations that may include a pounding heart, choking, nausea, faintness, dizziness, chest pain, hot or cold flushes, and perspiration. And if we talk about the signs or symptoms of specific phobia, the first one, have a persistent, excessive, and unreasonable fear of a specific object, activity, or situation. For example, heights, the sight of blood, or encountering a dog. Avoid situations where you may have to face the phobia stimulus. Example, not walking down a street where there may be a dog. If the situation is unavoidable, you are likely to feel high levels of distress. Find that the anxiety or avoidance associated with such situation makes it difficult to go about daily life. Example, interferes with working, studying, or seeing friends and family. Like animal type, fear that relates to animals or insects, fear of dogs or spiders. Natural environment type, like fear associated with the natural environment, example, fear of thunder or heights. And the blood injection injury type, fear associated with invasive medical procedures, example, injections, or with seeing blood or injury. Situational type, fear of specific situation, example, elevators, bridges, or driving. So these all comes in specific phobias. And if we talk about causes of specific phobia, the first one that comes in, that is temperament, and second one, a family history of mental health conditions. The fourth type is obsessive-compulsive disorder, which is also called OCD. Anxious thoughts can influence our behavior, which is helpful at times. For example, thinking, I may have left the oven on, leads to you checking the oven and keeping things safe. However, if that thought becomes obsessive, recurring, it can influence unhealthy patterns of behavior that can cause difficulties in daily functioning. Obsessively thinking I have left the oven on can lead to repeated checking. For someone with the anxiety disorder known as obsessive compulsive disorder, obsessions or compulsions acts performed to elevate the distress or neutralize the thought, or both are present. People with OCD often feel intense shame about their need to carry out these compulsions. These feelings of shame can exacerbate the problem, and the shame and consequent secrecy associated with OCD can lead to a delay in diagnosis and treatment. It can also result in social disability, such as children failing to attend school or adults becoming household. And if we talk about the signs and symptoms of OCD, the first point comes cleanliness order. Obsessive hand washing or household cleaning to reduce an exaggerated fear of contamination. Obsession with order or symmetry, with an overwhelming need to perform tasks or place objects such as books or cutlery in a particular place and or pattern. Counting, hoarding, second point. The third is safety checking. The fourth one is like sexual issues, like how sexual issues, having an irrational sense of disgust concerning sexual activity. And the fifth point, religious moral issues, feeling a compulsion to pray a certain number of times a day or to such an extent that it interferes with their work and relationships. People with OCD may also experience other mental health issues, including depression, other anxiety disorders, and an eating disorder, or alcohol or substance use problems. And if we talk about causes of OCD, the first one comes biological factors. The second point comes environmental learned behaviors, like some experts suggested that OCD may develop as a result of learned behavior, either by direct conditioning, example, developing a washing compulsion after contracting a disease from contact with an animal, or learning by watching the things. And if we talk about the fifth one, like panic disorder. What is panic disorder? Panic disorder is the term used to describe when panic attacks are recurrent and destabilizing. Panic disorders can be characterized by the presence of recurring and unexpected, out of the blue panic attacks. Worrying for at least a month after having a panic attack that you will have another one. Worrying about the implications or consequences of a panic attack, such as thinking that the panic attack is a sign of undiagnosed medical problem. For example, some people have repeated medical tests due to these worries, and despite reassurance still have fears of being unwell. Significant changes in behavior that relate to the panic attacks, such as avoiding activities like exercise because it increases the heart rate. Its signs and symptoms are like a sense of overwhelming panic or fear, the thought that you are dying, choking, losing control, or going mad, increased heart rate, difficulty breathing, feeling choked, excessive perspiration, dizziness. And if we talk about causes of panic disorder, so the first one, family history, like people with panic disorder tend to have a family history of anxiety disorders or depressive conditions, and some studies suggest a genetic component. The second one, like negative experiences, extremely stressful like experience such as childhood, sexual abuse, redundancy, or bereavement have been linked to panic attacks. Periods of ongoing unrelenting stress are also a risk of factor. And the last one, if we talk about PTSD, means post traumatic stress disorder. Post traumatic stress disorder is a particular set of reactions that can develop in people who have been through a traumatic event which threatened their life or safety, or that of others around them. This could be a car, means the incident of car, serious accident, physical or sexual assault, war or torture. War can also be the cause of PTSD, or disasters such as bushfires or floods. So as a result, the person experiences feelings of intense fear, helplessness, on or horror. And if we talk about the signs and symptoms of PTSD, like reliving the traumatic event, the person relives the event through unwanted and recurring memories often in the form of vivid images and nightmares. There may be intense emotional or physical reactions such as sweating, heart palpitations, or panic when reminded of the event. Being overly alert or wound up. And the third point, being overly uh, wound up and avoiding reminders of the event, feeling emotionally numb. So these causes is also like the presence of recurring and unexpected and feeling emotionally numb. So these all were the causes of PTSD. So this was our topic about types of anxiety. So I hope you have gotten. If still you people have any question, you can freely ask in comment section. And if you have liked this video, so do subscribe channel for the latest videos about other subjects. See you in the next video. Take care of yourself. Allah Hafiz.